Hi, Martin. Thank you so much for your presentation on edema. My name is Erin Gonzalez, and I will be presenting a case for your chosen topic. To start, the patient is John Doe. He is a 72-year-old male with congestive heart failure who gained a rapid amount of weight in a short period of time. Mr. Doe informs you that his hands and feet are swollen, as demonstrated in the slide prior and on this current slide. He says he has difficulty flexing his foot due to the amount of swelling that is present. You feel pulses, but they are difficult to find due to the amount of swelling in those areas. He has prolonged capillary refill on his fingernails and his toenails. And you press into the swollen extremities, which leave your indentations for about 3 to 4 seconds. So you ask Mr. Doe, has he had any changes recently? A change in his diet? Has he just been taking in a lot of sodium recently? Which he says, nope, he's been super great about staying on his diet. However, he does admit to you that he forgot his quote-unquote water pill while on a cruise for 7 days. So my diagnosis would be edema. He more than likely was retaining fluid due to his heart's weakened ability to pump blood effectively. The heart failure causes hypertension, which increases hydrostatic pressure in the vessels, which pushes blood out of the capillaries and into the interstitial fluid, which makes it difficult for fluid to re-enter the capillary due to the pressures. I would probably give a dose of Lasix to encourage a large output of volume to help bring the swelling down, and then educate the patient on the importance of just maintaining compliance with his medications. Lee et al. 2021 found that fluid overload was one of the primary causes of hospitalization among patients with heart failures, which indicates that providers should continue to stress the importance of their illness management. Yes, it was really great that Mr. Doe continued to follow his diet. However, it is important that he continues to take his medication as well. And then Patel et al. 2022 also recommended that he could try compression socks just as a non-pharmacological alternative to his treatment. Thank you guys so much for listening. Here are my references. Bye-bye.